everybody, my name is Lacey McCowan, and today I'm going to be talking to you guys about essential oils and how they relate to oral health. First off, what are essential oils? Essential oils are easily evaporated liquids that can be distilled from different parts of plants like the seeds, the roots, the bark, and used for different things. They can be used topically, they can be used ingested, they can be aromatherapeutic, but today we're mainly going to be talking about the topical use of essential oils and how they relate to the oral cavity. Some history on essential oils. Even in the ancient times, people knew the benefits of essential oils because most of their toothpaste included oyster shells, cadaver bones, different types of mints, and ginseng, which is root, and a lot of the time salt, maybe as an abrasive. So even then they knew the benefits and saw the difference that it made in oral health. Some uses, essential oils can be antimicrobial, they can be anti-inflammatory, they can be pain reducing, and as well as they can freshen breath, obviously with mint and cinnamon and things like that. But I mean, how do they work? That's the real question. How do they even work? You're just putting it on there and it's supposed to work well. Well, they are lipid soluble, so they are absorbed into the body quickly within about 20 minutes, and they have small molecules, which is why they can absorb so quickly, and they spread quickly because of the lipid solubility. And then they contain oxygen, so that allows them to transport nutrients as well. So that will help with healing times and things like that. Just taking a look here at some examples of reasons we may want to recommend some different essential oils in different occasions as dental hygienists. Periodontal abscess. We maybe wouldn't deal with it as much as the dentist would, but that is a very high complaint and a very painful thing for some people. So just a few examples on that one. Clove, which is a pain reducer, as well as anti-inflammatory. Helichrysum, melaleuca, frankincense, Roman chamomile, and wintergreen. Halitosis, which is a big one that we would want to look at. Maybe somebody says, "Oh, I've used all the medicated mouthwashes that people have, the doctors and things have recommended. Maybe they want to try something different." Some things would be peppermint, patchouli, and lavender. You wouldn't think lavender, but lavender essential oil is very good for halitosis. Aphthous ulcer, those can be extremely painful, so that is a high complaint in people who have them. Melaleuca, oregano, Roman chamomile, myrrh, basil, and orange. Candidiasis, which is another big one in our field. Melaleuca, oregano, clove, peppermint, thyme, lavender, eucalyptus, and rosemary. That one has a lot of options. Carie prevention, very important. Melaleuca, peppermint, eucalyptus, and cinnamon. Gingivitis, myrrh, lavender, melaleuca, helichrysum, Roman chamomile. Periodontal disease. In one of the studies that I looked at, they compared essential oils and using an ultrasonic scaler with it compared to just using regular water with an ultrasonic scaler, and it showed that subgingival bacteria count reduction in there was a subgingival bacteria count reduction in chronic periodontitis patients. So I thought that was very interesting. Herpes simplex, of course, there's no cure for it, but we can treat the symptoms, and we can treat those with peppermint, melaleuca, clove, helichrysum, lavender, lemon, eucalyptus, cypress, rose, and bergamot. There's a few more. Teething we really wouldn't get a lot into. Toothache would be more of the dentist thing, but clove is a good one for toothaches because it is a pain reducer and an anti-inflammatory. So those are all very good. Some more of the more common ones that you probably heard me list a few times. I have them listed over here and why they are good for those different things. Melaleuca, which is tea tree. That's what I have here. It's tea tree oil Some people, you would want to buffer it with some coconut oil, but in some occasions you can put it directly on the skin or on the gingiva. It prevents adhesion of periodontopathic and carcinogenic bacteria such as P. gingivalis and S. mutans, and it's great for homemade toothpaste. I actually have a at-home DIY toothpaste recipe, but it's pretty simple. Baking soda, which neutralizes the pH in the saliva and in the mouth, coconut oil as a buffer, and the essential oil of your choice. So in this case, if you wanted to use that tea tree oil to help prevent adhesion of bacteria, you could as a toothpaste, so that you maybe would get plaque a little slower. Another one is the helichrysum. It is antimicrobial. It helps to fight C. albicans and S. mutans. That's really good for denture wearers because they can get a lot of bacteria under those dentures. So sometimes that essential oil, you can just swish it around a little bit with some coconut oil, and that would really help with that. Bergamot is antibacterial and antifungal. That one has a citrus scent, so that's nice. Clove, like I said before, is pain reducing, but it's also antibacterial, antifungal, and it inhibits biofilm production as well. Ylang ylang is an antioxidant. That one we didn't speak on, but it's what works well with teething. Cinnamon, we see that a lot in toothpaste. It inhibits biofilm production as well. Oregano, that is used in cooking a lot, as well as thyme. Oregano is soothing and antimicrobial, and thyme is in the mint family, and it's often used in mouthwashes, which you wouldn't think, but it is. Peppermint, of course, is cooling and numbing, which is pretty common. You want to get the cooling hit in the cooling feeling in your mouthwashes and toothpaste. It makes your mouth feel fresh, but it can also be numbing as well. Some people would use that for a toothache, but you have to be careful using just the oil itself without a buffer, because it can degrade some fillings. So you would want to really watch out for that. Essential oils are already used in many over-the-counter products that we see every day, and we just don't think about it. Listerine, in many of their different products, they use essential oils. Listerine uses eucalyptol, which is from eucalyptus, and that lowers airway and oral cavity mucus, as well as anti-inflammatory. So that would be good for if people say, like this one is Total Care sensitive, they could say, oh, well, the burning, I don't like the burning. It's an anti-inflammatory, so maybe their gingivitis is what's causing the burning when they're swishing with those alcohol mouthwashes, and that would help with that. It also has menthol, which is a peppermint, and that would make you feel fresh, and it's cooling and numbing. It has a pain suppressant, which is menthol salicyate, and that is in the Total Care one as well. And the Cool Mint has thymol, which is an antiseptic. So those are all very good. Hello brand, which I'm sure you've seen in a lot of grocery stores. It's very big now. They are all natural oral care products, and they use a lot of hemp seed oil, which is an anti-inflammatory, and green tea, which reduces organism growth. Crest 3D White, all natural. They use ginger oil, which is anti-inflammatory, tea tree, which lowers bacteria growth, and charcoal, which is the abrasive. But there's another company called Fro Fowler. They have a tooth and gum powder, which is like a paste, but you would kind of make the paste yourself. You would get your toothbrush wet, dip it in the powder, and that would be what you brush your teeth with. They have different flavors. They have one is citrus mint, powder mint, orange clove. So those are the ones that you would choose between depending on what you're using your powder for. They also have flosses. They have lozenges, which they say lower the pH in the oral cavity. This is Camellia, which is a teething product. That one has the lavender and things in it, just like listed here. Gum massage gel by Zarbee's. It's for babies that are teething. That also has a lot of essential oils in it. Here's one by Red Cross. It's a toothache gel. That one has clove. there are many different ones that aren't listed. There's so many out there now, and I just think that with the growing popularity of going all natural and people being tired of using those antibiotics that they're building up an immunity to and things like that, or they're building up a resistance to more, that maybe they want to try something else. Well, I just have to keep taking these antibiotics every time, and I just keep getting this or that, and I just don't want to take antibiotics anymore. Maybe they would want to try something else, and they may want to go the more natural route, and you could suggest something like this. Someone who has candidiasis, you could suggest this. Maybe they don't want to use a medicated mouthwash or something like that. But the only cons I would say would be the cost, because it does take so much plant product to make a small amount of oil. It does cost a little bit more, but it's definitely worth it. It goes a long way. Like this little bottle would last months, probably past its expiration date, I'm sure. Unless you used them excessively, they last a long time for personal use. And you could even have them in office as long as they agree to it and you're putting it in your charting. You could use it in office. Oh, this is kind of painful. You could use the clove oil or whatever and just let them try it. Just always be cautious of overuse or misuse, because it can cause negative reactions if you just really overuse it and use it incorrectly. It can cause malabsorption of other vitamins and things like that, which we would definitely want to avoid. And even in office use, or if you are suggesting it to a patient, make sure to stress to try it on a patch of skin or try it on a patch of gingiva first, just to make sure you don't have any reaction to that plant itself. But other than that, yeah, I think that essential oils are very positive for the oral health situation with dental